Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill Smith. Welcome back to Fire 'em Up Doctors, Good Medicine Doctors. We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
All right, so that was our introduction video. Today we're joined by Dr. Anjali Mon-Akey. Unfortunately, Dr. Kathleen O'Neill Smith was caught up in clinic today, so hopefully we'll see her in the next couple of weeks when she comes on. But for today, we have Dr. Anjali Mon-Akey, and she's right here.
Hello, everybody. Thank you for joining me today. Dr. Kathleen gives her best regards. Do you believe we've been together now for 28 weeks? That's like over half a year. And I wanted to let you know that we are committed to continuing this webinar series until this pandemic is over. This will be the final in the series we've had in terms of COVID conversations, because I'll tell you at the end of this webinar, we're pivoting to a more wellness-based webinar series called Pursuing Wellness. But we will have incorporated in that content the last Thursday of the month, we will be doing COVID updates. And certainly if there's anything urgent and pressing, we'll interrupt our programming to do COVID. But I think over half a year into this, it would be nice to pivot to more functional, integrative, regenerative, restorative internal medicine based on themes. And I'm so excited to share that with you. But first, we're going to go ahead and wrap up where we are with this COVID pandemic. Basically, this is how we started as a group 28 weeks ago. The state of emergency was declared on March 13th. Here we are now. There's a lot of COVID. In fact, just today, I saw 3 new COVID patients. So there are people who don't believe that COVID exists until they get it. So I still want our patients and our viewers to be really cautious. Wear a mask, 6 feet distance. Don't gather with more than 10. The weather is beautiful in North Central Florida. Go outside. I have 30 interns in my office. We're actually going to meet outside at the park next week for the first time in months. And be careful, especially with seniors, hanging out with seniors who might be really sick and get complications from being sick if they get infected with COVID. Next slide. So I'm going to update North Florida. Dr. Kathleen said they're really strict in Boston. You get fines if you don't wear a mask. But here in Alachua County, we've had 51 deaths. We're managing we've managed over 30 to around between 30 and 40 COVID patients. Again, 3 new ones today. Happy for my practice here in North Central Florida, we finally received our rapid COVID antigen swabs. Remember, I told you I ordered them months ago? But because I wasn't working for the government, they prioritized government-based practices. I finally received rapid COVID antigen testing just in time for flu season. And the same machine actually does rapid influenza A and B testing. So with one visit, we can rule out COVID as well as influenza A and B. Now, as you might have read in my Kick COVID-19 to the Curb guidebook, with acute COVID, you miss up to 30%. So I still go with symptoms. Like today, I managed a 63-year-old man who had COVID symptoms, lost his sense of smell, has a little chest pain, feels flu-like symptoms now for 10 days. He got swabbed a week ago. The swab was negative elsewhere, but because of his symptoms, primarily loss of sense of smell and that weird chest pain, he's COVID. He has COVID-19 virus until proven otherwise. So I'm managing him just like he has COVID, because I know that you can miss up to 30% or 3 out of 10 of active COVID with COVID swabbing. Now, the one that I purchased had the science says that it's 84% sensitive and 100% specific. So if you start having symptoms or anything like that, just email the hotline if you're in our practice in North Central Florida, nfimgmv at gmail.com. That's North Florida Integrated Medicine, Gators Make Victory at gmail.com. And I would say so far we've been victorious, because out of our thousands of patients, we've had 30 to 40 sick. half a dozen hospitalized, 2 intensive care units, nobody intubated, and we haven't lost anyone. So far we're doing really well. And I would just beg you, if you start having any symptoms or you had accidental exposure, make an appointment right away because we will get you through it. Remember phase 3, there's 4 phases to COVID infection. Phase 1, asymptomatic. You could be asymptomatic for 2 to 5 days average. Phase 2, symptomatic, cold symptoms, flu symptoms. About day 10, you can move into phase 3, which is the danger zone where the lungs get involved. And phase 4 is cytokine storm, and that's dangerous. So we like to see you sooner rather than later. And I think the reason why we've been successful is we've been preventing you guys from getting sick in the first place, teaching you how not to get sick as much as we can. And you all have been very good at physically and socially distancing. But as a county in North Central Florida, we're still doing quite well. This week, we've had 23 hospitalizations, and our death rates, our case fatality rates are 6 out of 1,000. So it's holding quite strong. So we're doing really, really well still here in North Central Florida. I would remind you that the early studies from Wuhan, China that I presented in March said that the fatality rate was 6 out of 100. Here in Alachua County, we're 6 out of 1,000. That does not mean to throw caution to the wind. Like I said, I still want you all to be careful. I'm holding out for a safe and effective vaccine, which we're going to talk about, or a safe and effective treatment, for especially if you're medium or high risk within our patient population. Next slide. So that's what we're talking about today, and start getting your questions ready because I'll look at the chat in a moment. So, wrapping up the COVID conversation series, and again, all of these have been archived at North Florida Integrated Medicine Facebook page. There's been, 28 webinars. And then when Dr. Kathleen O'Neill Smith and I got together for the Fire 'em Up Doctors webinar series, it's now located at fireemupdoctors.com, our YouTube channel. It's archived within a couple days, so you could send your friends and family. In addition, as we move to wellness, I would definitely ask that you share these series with your friends and family, because we look at systems. We try to fix root cause before you get sick. That means we try to stomp out fire or inflammation, rust or oxidative stress, and try to optimize your immune system. So we don't like to wait until you're sick to say, oh, let's fix it. It's like fixing your house after the roof is already leaking. We're trying to help you and empower you to take control of your health now, to plug the holes in your body, or specifically your immune system army, before you get ill. And I think that is the best way. That's actually ancient medicine. It's Chinese medicine, but it's all the ancient treatments. It's just that in our culture, in conventional medicine, we've moved to a sick model where we have to wait till you get sick in order for insurance to cover it. And that makes zero sense at all. So today I wanted to have a conversation about where we are in COVID vaccine development. And I wanted to give you an idea about how to tell the difference between influenza, and COVID-19 virus, realizing that there's some similarities, but there's, in my opinion, 2 key differences. Also realize that there are reports from the first season of COVID, early COVID, that you can have something called co-infections. Co-infections, meaning there have been reports of people getting COVID virus with influenza together. Do you remember patient 0 in our population? She had come home from Italy, and it turns out in retrospect, she had 2 infections, COVID virus and a virus called respiratory syncytial virus. She had COVID with RSV, and that's why she was so sick and went into the hospital. And by the way, her lungs still haven't recovered. And we've talked about that, the residual from having COVID, the injuries in the immune system in the lungs after having COVID. I guess the nickname for people who aren't recovering right away, they're called long haulers. Well, A, we don't want you to get sick in the first place. B, if you were to get sick, we want you to get through it unscathed. C, if you end up being a long hauler, we want to help you get through that by these principles of wellness we'll be teaching you as we roll out the new series called the Fire 'em Up Doctors Pursuing Wellness webinar series. And that starts on Thursday, October 8th, same time, same station. We're just taking a little break to prepare for that next Thursday, October 1st. There will be no webinar, but then we'll get rolling again with this new series Thursday, October 8th from 3 to 3:30. Okay, and I'll tell you more about that towards the end. Without further ado, I don't know if you know this man. It's not Dr. Anthony Fauci, who I really adore Dr. Anthony Fauci. I told you that before. I think he's a solid scientist. But there's this other very humble man. I don't know if you remember the lead on the Human Genome Project from 2000. His name is Dr. Francis Collins, Collins. He's about the smartest MD, PhD doctor, but also the most humble doctor that I know. And later on, we'll show you a slide. He's getting honored tonight at 7 p.m. It's called the Templeton Award. To me, it's equivalent to like the Nobel Prize, but the Templeton Award is for science and spirituality. Previous honorees of the Templeton Award were Mother Teresa of Calcutta and the Dalai Lama. So it's going to be very inspirational for those of us who are involved with medical care, but also realize that Francis Collins is the National Institutes of Health director, and he has been working literally night and day trying to get this vaccine going. On the little video clip for the Templeton Award, he was interviewed, and he says he wakes up every morning at 4:30 a.m. and communes with God first. And then at 7 o'clock, he starts all of his calls from all the departments of the NIH, and he keeps working and working and working. But that aside, he presented to the Senate about 14 days ago. And this is his slide that I'm showing you here. And you could look at the whole hearing. But he's very reliable in terms of being a scientist. And this is what he said about vaccine development. And this is a quote. He says, "I'm cautiously optimistic that we will have a vaccine either at the end of this year or the beginning of next year." So when he said that, I actually somewhat believe it. But he actually went through the science, which I wanted to share with you because it's really neat science. Okay, so remember how vaccines work. Most vaccines now are dead vaccines. Okay, the spike protein over here are the little flowers on the top of the Corona-19 virus called the SARS-CoV-2. That is a target for most of our interventions, okay? Vaccines ask your body to make your own antibodies, and that's a Y shape way over there on the right. It's in yellow. It's a Y, that's antibody. And that's supposed to bind the protein and neutralize it, okay? So this is how there's 3 ways that vaccines, they're going through the vaccine trials in 3 different measures, spending tons of money just in case they have the winner, and they totally expect that the others may not work. But there's backups upon backups and a lot of money invested in there. And there's 6 biotech companies racing to find the answer. 3 of them are in phase 3 clinical trials. You might have heard on September 10th that AstraZeneca had to hold one of their phase 3 trials in conjunction with Oxford because there was a patient who had an inflammatory spinal disease, and they thought it might have been related to the vaccine. So they held it. But as far as I know, I didn't see that was active again. There's actually, if that's still not active, there's at least 5 out there racing to find the answer to a vaccine. So I thought it'd be fun for our crowd to hear the science behind it. So up there, the option 1 at the top is one method where you actually have the spike protein that is purified and is injected into the body. And the body, the immune system army, if you read Kick COVID-19 to the Curb, the immune system army finds it and makes antibody. But because it's only the protein, it's not going to take over your cells and replicate like the virus will. That's the usual way we develop antibodies. The second in the middle, where you see the double helix RNA, actually, the spike protein gene is purified. Actually, that's a DNA, I think. It's an RNA virus. So let me not get myself confused. So anyway, it's nucleic acid. It's put in an adenoviral vector. Okay, that's a virus vector. And the body produces the spike protein because it's in a vector. And when the body sees the spike protein that got produced, then the immune system produces antibody. Okay, because that's the goal, is to get to the yellow Y, which is an antibody. Okay, the third way is the newest that the NIH developed. The mRNA that codes for the spike protein is purified and injected. And then it gets into like a muscle cell or something like that. And then the body makes the spike protein, and then the antibodies are produced. Okay, so basically that is cool. That the third way is new and developed by the NIH. So basically there's a race of 6 biotech companies involved, including the NIH, to develop a vaccine. So that is my vaccine update for you all. I do believe Dr. Francis Collins, and I do invite you to come to his award tonight at 7 o'clock. I'll be there. I was so happy to be invited, but it's free. We'll give you the web link to register. It's virtual and free. Now let's move to the second question. Yes, the answer is if you normally get a flu vaccine, please get a flu vaccine. Okay. If you're 100%, Sheila wants to know, if I don't normally get a flu vaccine, should I get a flu vaccine? I would make an individual telehealth conference with me specifically to discuss the pros and cons, because there some of you all have a little nuances to vaccines, etc. And at the end of this, I will comment that if you intend on quarantining strictly, getting food delivered and everything else through the season, and I'm worried about you getting a flu vaccine or any vaccine, then you probably don't need a flu vaccine. But that is an individual discussion for most of you. If you normally get flu vaccines, I want you to get a flu vaccine. If you're over 65, you get the high potency flu vaccines. Ours have been ordered. We're expecting them any day now in the next couple of weeks. And I've designed a drive up to your car, get your vital signs and inject your arm protocol so you don't even have to come in the office. So if you're interested in that, then email. If you want one of those where you're just driving up and we're injecting your arm, then email the hotline, NFIMGMV, Gators Make Victory @gmail.com, if you belong to the practice called North Florida Integrative Medicine in North Central Florida. Okay, so we're trying to make it super easy and super, super safe. Okay, Peggy, hold on that question, because I do have slides that there is evidence that because you're quarantining, there is going to be less flu, correct? But I actually have a study to show you that. Okay, let's go ahead and so that you become sleuths in your own body, you need to know the differences, the similarities and differences between influenza and COVID-19. Like I said, I was so thrilled yesterday, just yesterday, we finally got the machine I ordered 4 months ago that does a rapid influenza A and B test and a rapid COVID test all in one. You get the results in 15 minutes. So let's say you had flu-like symptoms and I said, okay, come up for drive-up evaluation or a tent visit. You're one of our patients. I go out there and swab you with my N95 and my shield. I say, go wait in the car. The weather's good. Listen to your radio, whatever. Or go home and I'll tell you the results. I'm really, really happy about this because they can come as co-infections. But if you want to have a clue, here's the chart. Take a picture of this if you'd like. But basically, here's the differences and similarities. Influenza, okay, there's two kinds, A and B, all right? Patients can be asymptomatic if there's herd immunity. That's true. COVID-19, most patients develop symptoms within 2 days up to 5 days of infections of COVID-19. Influenza, viral shedding is 5 to 10 days. COVID-19, you could keep shedding up to 14 days or longer, okay? Severity of illness with influenza, most are mild to moderate. And then with COVID-19, I think if you've been with me for 28 weeks, you know that there's a small fraction of people who could get severely ill. Influenza mortality is less than 1%. COVID-19, you got to look at the region. Ours is, North Central Florida, our mortality is less than 3 to 4%. But in this paper, which isn't that old, it's 2 or 3 months old. I say that and I laugh because we consider papers old if they're 2 or 3 years old. But now if they're 2 or 3 months old, they're a little old with COVID. So it's just amazing how things have just moved really fast with the science and preprints. Okay, vaccines with influenza are available. Realize last year we kind of missed. The vaccine efficacy was only like 30 to 40%. That it wasn't that great last year. So we have to guess in advance when we release these vaccines how the antigens will look with the influenza. Hopefully it'll be better this year. COVID-19, you heard about vaccine. Many are in vaccine clinical phase 3, and then they get released clinical phase 4 to the general public. But realize sometimes after we release it, we to the general public, we see problems. So if you are being approached for a vaccine trial, seriously, please talk to me or Dr. Kathleen first to see if you're even a candidate for the trial. Because really cool, in October, we're actually going to be talking about immune system adjuvants. Adjuvants are things that happen to your immune system that trigger autoimmune disease. We'll use it as an illustration. We're going to talk about a patient with breast cancer and textured implants who developed lymphoma as kind of a platform for understanding these concepts on your immune system. Okay, so influenza does have treatments. Go back, please. Those are FDA approved treatments. COVID-19, the reason why we like to prevent is because there's no treatment that we know for sure works. There are FDA approved interventions like intravenous immunoglobulins, should you be sick enough, someone else's convalescent plasma rather. And in the hospitals, we can use antiviral, potentially, okay? We worry about the COVID lung disease, influenza less so. Next slide. Okay, now this is a paper that was published about 4 or 5 months ago, and this is exactly what Peggy was asking. So here, go back and look at what normally happens. Remember, COVID hit in the first quarter in the United States in early 2020. So normally in the blue is how we normally expect the line to go up. So towards Christmas and after Christmas, blue, we would expect it to spike up just like that. See how, go back, go spike up, go up like that. Okay, that's normal. But what happened was we all quarantined and the actual incidence went down of influenza. So you see that? So we anticipate that's going to happen is as long as we continue to quarantine in. Just to repeat this, what happened in the first quarter in the United States is that we normally spike up after Christmas holiday. That's blue. But instead, we went down. And that's what we're hoping and praying happens if people continue to do physical distancing and quarantine. Next slide. And remember, non-pharmaceutical interventions like hand washing are still critical, please. 20 seconds, 2 happy birthdays. Don't forget, you know, and I used to play basketball in high school. The basics, you need to remember the basics. Wear facial covering, mask. If you have access to N95 mask, even better. There was a study that people who are myopic, nearsighted, wear glasses, they have less transmission, and they think it's because they're covering their eyes. Very reasonable for you to wear a shield with your mask if you're in public or traveling, or if you're in a crowd. Glasses, you could buy, you could buy lab glasses anywhere, okay, with a mask. So next slide. Okay, and that's the point, is that there was a smaller post-holiday peak, and hopefully it will be the same. And I don't know if you guys are getting used to doing things more towards home, but I think it's fantastic that there has been some ACE stories that I've had in my patient population that people have actually reconnected with their family. They exercise as a family. They do a lot of neat things together. So I'm going to choose to focus on the ACE story here, as we wrote in Kick COVID-19 to the Curb. Next slide. Okay, that's what it was saying, was that the quarantine was probably responsible for the dip instead of the spike at post-holiday season, January, February of 2020. Next slide. Yes, so I only have a few medical heroes, but I follow my medical heroes very, very closely because someday I want to be like them. And if you haven't read this book, Francis Collins found God through science because he was the actual director. He was a project manager for the Human Genome Project. So I followed his scientific career for a long time. But if you haven't read this book, and it's an audiobook, it's very inspirational. Better yet, sign on to this free live ceremony tonight that's going to be honoring him at 7 p.m. And you can totally trust him. He's totally trustworthy in terms of vaccine development. Again, he's a National Institutes of Health director. He's above reproach, apolitical. Really, he just wants us to be well. And I think that I'm so honored that 27 you all have come in today. Many of you have come in for 28 weeks, and many of you on Facebook are now joining us. You can trust Francis Collins. And I hope you do join me and watch his ceremony tonight at 7 p.m. honoring his life legacy, which is not only the Human Genome Project, which I thought was huge. As a kid in medical school, I was watching what he was doing to map the entire human genome. He actually said this is bigger for him. trying to find a vaccine and protect the American people. COVID is bigger for him than the Human Genome Project. And so trustworthy. You can watch his Instagrams, Facebooks, really to keep an eye on COVID, because like I said, we're going to be pivoting. We're not going away from COVID. We'll still answer your COVID questions, even though we're moving towards wellness. And again, it's going to be the fourth Thursday where we do COVID updates, the fourth Thursday of the month where we have this format. But other than that, we're going to be pivoting to what Dr. Kathleen and I know really well, which is functional, integrative, regenerative, restorative internal medicine. Okay. Next slide. All right. So let me, and then Nicole, you can unmute and you can pitch me questions. I'm going to go ahead through the chat and try to answer these for you all. Okay. Peggy asked, don't you think there will be less chance of passing or catching the flu because we're all wearing masks? Yes, please wear masks. I don't really understand why people don't wear masks. Please wear masks. They're pretty ubiquitous at this point. Even when your family gathers, I tell you, most of the people who got COVID, I've cared for myself in the past 3 weeks, were accidental exposures in the home or even outside. There was a couple who've been so rigorous. Whole Foods delivery to the house, not meeting with anybody. I met with them today. They're in their 30s, so rigorous about being careful. Well, somebody came and talked to them through their lanai without a mask, about over 6 feet away, maybe 8 feet away. And basically they didn't want to be rude. And so they didn't say wear a mask or come back later or let me get my mask. They just had a conversation with them through the lanai. And within 24, 48 hours, the wife started getting symptomatic with flu-like symptoms and viral symptoms than the husband 48 hours later. And so they're probably COVID. Now that's a little bit of further distance, but maybe it was the length of time they were interacting. Normally we do say it's 6 feet, but if the wind's blowing your way or something, there was some transmission there. Another is an 80-year-old couple who've been so great. They live in a condo or complex, and then a young man just started talking to them, and then he got COVID tested positive later. And again, it was just a casual kind of thing. So don't let your guard down is my point at this point. Okay. Okay. Should you wear a mask outside? I wear a mask outside only when I'm passing people. So my exercise, I try to walk 3 miles, if I'm really good, 6 miles a day, just to keep the blood flowing. But in consideration of other people, when I see people coming my way, I'll put on a mask. But that's like so relieving not to wear a mask outside. What do we think about flying? All right, so I tell you, we have a younger son who's an athlete in Oregon. And the week before the fires hit Oregon, and to celebrate his birthday, poor guy's turning 20, he was homesick and everything. We decided to risk it and get on a plane and fly. So we did all of our usual, Argentyn silver, PRP spray, C, D, zinc, omega. And we all wore a mask and glasses on the plane. And we went to see him. And then our policy in the office is you quarantine the week after. You can't come to the office if you've been flying for a week. And then we just watch temperatures. So unless it's compelling, and I know it's getting compelling. I mean, if your doctor's is hopping on a plane, it's 6 months later, it's compelling you miss your family. So I would say that if you're medium or high risk, you should probably do a telehealth with one of us to make sure you're fortifying yourself really well. If you're low risk, if you're 20s, no problem, probably. Just be careful, make sure to wash, especially at the airports, especially at the food courts, right? Still distance as best you can. So I know things are starting to move again. So that's a great question. Okay, Nicole, are there any questions from the Facebook?
The one that I put in the chat is the only one we've received on Facebook. Okay.
If you go one more, I just want to, and I'm looking at the chat if you guys have any questions on the call. I'm just looking to make sure I've covered all the questions for today. Okay. Okay, if you'll go one more to the rainbow. All right, this is what I'm talking about. So Dr. Kathleen O'Neal Smith and I, we co-manage really hard patients. I don't know if you know this, that it's really nice to finally have a doctor who thinks like you and vice versa, who's got your back, who understands the science of what you're trying to accomplish, which is root cause medicine. And because we feel so passionate about it, we actually are going to be releasing the book that we put on pause for Kick COVID-19 to the Curb. It's called Fine Tune Your Immune System. That'll be released in the spring. Kick COVID-19 to the Curb. Thank you for this crowd recommending it to your friends and family. We've sold about 350 organically. If we sell 900, a big publisher is going to pick it up in New York City. So we're still trying to get that out there, because really every time I see a COVID patient or exposed patient, I say, go to the website, get the guidebook. It's $9.99 on Amazon, or if you're local, come get the paperback. It's been really helpful managing COVID patients. And by the way, if your friends and family don't have resources, on the website free is the 14-day monitoring guide, as well as a chapter on first aid if you get COVID, a chapter that I did the audiobook, a 6-minute chapter on first aid if you get COVID or have exposure. And Audible is still looking at that 4-hour and 30-minute audiobook called Kick COVID-19 to the Curb. But pivoting to 6 months into our series on COVID, what our intention is, and I hope you all join us and share this with your friends and family. We're going to take a break next Thursday, October 1st. We're not going to have a webinar. And after that, we're going to take the deep dive into this new series called Pursuing Wellness with Dr. Kathleen and myself. And here's the intention. Next month is Breast Cancer Awareness Month, as well as Liver Health Awareness Month. And you know how to tie that together. We actually are I got permission from a patient to present her case. And she basically is in her late 40s with who had textured breast implants, who developed lymphoma or cancer. And part of that is the liver, having to clean up the liver to detoxify and boost the immune system. And so these are hard concepts even for regular conventional doctors. So we're just going to make it really user-friendly for you all, where the first 3 weeks, Thursdays of the month, we have the case presentation. Then we're going to have an expert, just like we had Dr. Brian come in. It'll probably be Dr. Anna Kabeka if she has time to come. And third, we're going to do variations on a theme, meaning we'll talk about different cancers and how we think we can approach it from an integrative standpoint. The fourth Thursday of the month will be, again, the COVID conversation update. So it'll look like the format you just saw. And then the fifth, if there is a fifth Thursday, it will be open mic Q&A for anything you all want to talk about, realizing that we have multiple board certifications and we could talk about a lot of things. My passion is actually how to use functional integrative medicine to regenerate, to restore, and that's hers as well. So I don't know if you know, Dr. Kathleen O'Neal Smith is not only an Olympian, but an Olympic coach in rowing, a previous Olympic coach in rowing. So she's treated NFL players, Olympians, et cetera, in regenerative medicine. So that's actually her specialty. So happy that you all have come for the past 6 months. We're going to close out the COVID conversation series now, keeping in mind we will keep that fourth one on COVID until this pandemic is over. Feel free. I'm going to give you guys permission, even though the topic might be breast cancer. If there's an urgent COVID thing that you want answered, this landscape's changing so quickly, we'd be more than happy to answer them in our Q&A chat sessions. And please, if you wouldn't mind sending this out to your social media contacts so that they can enjoy the webinar series as well, or give them the links if they don't want to be on live on the Zoom, if they want to watch us on our Facebook Live series, either at North Florida Integrative Medicine Gainesville or the Fire 'em Up Doctors Facebook page. All right, so I hope you guys are as excited as we are. And for now, I'm going to sign off to Nicole. Thank you all so much for joining us for the past 6 months in this COVID series. For now, be safe, be well, and God bless you all.
Thank you, Dr. Akey. So I'm gonna go ahead and close this out for today and do the remaining slides. So like Dr. Akey was just mentioning, October, we'll be talking about breast cancer and liver health awareness for the first the second Thursday on October 8th. And the fourth Thursday will still be our COVID update. We're hoping to send out a survey to all of our Zoom participants that we have on our list. Expect that maybe sometime next week. That way we can get your guys' feedback and maybe some topics that you guys have interest in that we can implement into our future wellness webinars. We just came out with a Kick COVID-19 to the Curb Fall Flu Season IV special. It's a series of 4 IVs. These are some of them right here, and it includes a Kick COVID-19 to the Curb guidebook as well. If this sounds interesting to you and you want to learn some more information about this opportunity, this will be a limited time thing, so you don't want to miss out. You can email right here, which is fireemupdoctors@gmail.com, and I can go ahead and put that in the chat as well. And this you can email also if you have any further questions from the webinar as well. We still have 3 coupon codes going currently. These are the ones you've maybe seen in previous weeks. We have this Body Bio product. It's a complex of phospholipids. The coupon code is up here, and it's through our fireemupdoctors.gethealthy store. You can access this on our Fire 'em Up Doctors website by going to the shop tab and clicking on Get Healthy. And once you create an account, you can view all of these. We still have our Fire 'em Up Ageless Triad on sale, which is a great deal. It includes these 3 liposomal Numedica products, and that is the code up here, Fire 'em Up Ageless, and it's through the same website. And this is only valid until October 1st, so shortly it'll be ending. And the last one we have are these 2 Omega products. We have Pro Omega, and this is that coupon code. And then we also have Algae Omega, and this is for our vegans. And that is the code down here. And again, the same website. And this is Dr. Akey's textbook that she recently came out with. It's called Fascia, Function, and Medical Applications. We have it available through our North Florida Integrative Medical Office. You can call or email right here to pick up your copy. But when you pick it up in person, it does not include this 20% discount. This is only through our Fire 'em Up Doctors website. So when you're on there and you go to the shop tab, you can click other books. And once you click that link, that'll bring you to a website where you can purchase the textbook and use this discount code for 20% off. But again, you cannot get the discount code in person at our office. And we still, of course, have our September special with Kick COVID-19 to the Curb. Ultra potent vitamin C and zinc are 20% off if you purchase the paperback or ebook. This is only good for one-time purchase, so make sure you keep your receipt. And you can call our office or email that hotline, nfimgmv@gmail.com, if you'd like to do this. And these are great supplements to help fortify your immune system as well. And I'm gonna go ahead and play our outro. Thank you, everyone. See you on October 8th.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.fireemupdoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out.
The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.